great that you've taken the opportunity to let me share Reimagining Education, Pathway to Change. Today we're going to talk about what's been happening in nursing education during the pandemic, and then some strategies to continue the improvement of nursing education. What happened in March 2020 when we heard new language? And this newspaper, this headline says it all: stay at home. So when we got that news, what happened in education? There was an immediate transition from classroom to virtual learning. Well, we lacked time, equipment, and resources to make that transition easy. Clinical practicums were shut down. There was high anxiety, limited emergency preparedness, usually related to bomb threats or inclement weather, and confusing messages from all sides. Who do you believe? As we moved along the pandemic journey, we translated all the requirements into action, whether it was related to PPE, graduation, whatever it was, but nursing education was very much involved. We tried to communicate. Sometimes it worked, but if we sent out a communication in the morning, by afternoon, it could have been completely different. We needed to apply lessons learned, to use new learning methodologies, but it was all very different and took a lot of energy to move ahead. There are many drivers of nursing education in the United States. I'm going to mention a few, but a landmark one was in 2010. The IOM, the Institute of Medicine's Future of Nursing study, had great ramifications for nursing education. One of the recommendations, having nurses practice at the top of their license, but it was the other one, the 2020 rule that had the most impact. And that rule said by 2020, 80% of practicing nurses would have a baccalaureate degree. Wow, did that change nursing education with the imploding and the growth of RN to BSN programs and new partnerships with associate degree programs, and nursing practice was changed. The American Association of Colleges of Nursing has put out a landmark report in 2017, and in 2021, the National Academy of Sciences, Engineering, and Medicine has put out another report, Future of Nursing 2020 to 2030. The American Association of Colleges of Nursing has also just published the Essential Core Competencies. So you can see nursing education is always looking for ways to improve what it's doing. And all of us are part of that. This slide looks at the data from the 2020 U.S. Census report. Very important information. In 2010, the U.S. population was composed of 63% white. In 2020, 57%. Blacks in 2010 made up 12% of the population. In 2020, 11.9%. Hispanic Latinos in 2010, 17.3%. In 2020, 19.5%. And Asians, 5% in 2010, now 5.9%. This more multiracial, multi-ethnic has great implications for how and where nurses practice, and the recruitment of a much more diverse nursing faculty and student body. I want to talk just for a few minutes about the innovative strategies that all of us need to think about. Yes, the recruitment, retention, and preparation of faculty, the development and implementation of diversity, equity, and inclusion strategies, new learning methodologies, emergency preparedness. But the one that I want you to think about most is fostering health and well-being in faculty, students, and staff. Without well-being, a sense of well-being, people cannot do what they need to do. Not only saving lives and stamping out disease, but thinking about improvement. So what would a reimagined nursing education landscape look like? It would be all about exceeding expectations. There'd be well-equipped student and faculty toolboxes to do their work. There'd be a high level of student, staff, and faculty engagement. There'd be recognition of student and faculty scholarly achievements. There'd be ownership and accountability in implementing diversity, equity, and inclusion strategies. And every college and learning environment would be known as the best place to learn and the best place for work. Think about it. Together we can reimagine our future in education, because if we reimagine our future, we will prepare nurses who will be able to shape the future of healthcare in collaboration with other disciplines and to make a difference in the lives of patients and families every single day. Take a moment, step back, and reimagine nursing education and what you can do to make a difference in the future.